I'm going to tell you about passive movement at the upper. So passive movements are usually performed by the therapist, not by the patient. In this movement, there is no effort by the patient. So usually the passive movements are performed to maintain the range of motion at the joint, to maintain the muscle length of the joint. Because usually it is done by the therapist in the conditions in which the patient cannot perform the movement on their own. So starting with the shoulder joint. So the first movement is shoulder flexion. So for the shoulder flexion, the therapist position will be standing position. Patient position can be sitting or in the supine as shown here. So starting with the shoulder flexion, the hand placement of the therapist, one hand on the distal humerus and the second hand on the distal forearm. So the therapist performs the movement this way. Now for the shoulder abduction, same the therapist movement hand placement would be same as for the shoulder flexion. Now the shoulder would be in the slight for the slight flexion and elbow 90-degree flex. So in this way we can perform the shoulder abduction. And for the rotation again the shoulder in slight flexion, elbow in the 90-degree flex. Now in this way we can do the internal or medial rotation and then we can do the external rotation in this way. Now moving towards the elbow joint. Again the hand placement would be at the distal humerus and other hand would be on the distal forearm. So for the elbow flexion we can perform this way, and for the elbow extension we can perform this. Now at the wrist joint, again one hand would be on the distal forearm, other hand will be grasping the hand of the patient. So for the wrist flexion we can perform this, for the extension like this, for the radial deviation like this, and for ulnar deviation like this. We can a little bit modify the placement according to the, we can say, comfortable position or according to the patient satisfaction also. And for the radioulnar joint in which we can perform the supination pronation, again distal forearm will be grasped by the one hand and then one hand will be grasping the patient's hand, and we can in this neutral position we can move into the pronation and then into the supination, and we can also perform it by taking the support from the floor also. In this way we can perform this movement. So passive movements are usually performed in the patient in the conditions in which the patient cannot perform any movement, like in case of bed rest, in which the complete bed rest is advised to the patient. Uh, so to prevent atrophy of the muscles, we can perform the passive movements in the